There's a certain area where you dress in your, what they call the PPE. You have a full body suit, boots, 2 sets of gloves, apron, hood, goggles, face mask, and that's a part of the hood. And then you wear a mask that has better filtration than the regular mask on the hood. And so you dress in that get up every time you go in, and you don't want any skin exposed. You don't, but you also have to be able to function and move. So then you enter from what we talk about, from the low risk area up to high risk. You enter into a suspect area, then probable area, and then a confirmed area. So the women whose births I did there were all confirmed to have Ebola, but they were all in a process of recovering. So in doing the births, we set up a couple of different things. We set up a private area where they could birth. We had to go in every couple hours to give medication for the inductions. When the birth itself happened, we tried to stay out of the high-risk area while the actual birth was taking place, because you can only be inside for about an hour at the most, and because of the heat, because it's difficult to function after that time, and you don't want to be making mistakes. You don't want to do something that's then going to injure you, put yourself at risk, or put your co-workers at risk. You always go in with at least 2 people. For the births, we had 3 in with us. 1 to make sure that everything was going well, also to take the chlorine sprayers to spray all the different bodily fluids. So we tried to time it that the birth itself was happening as we entered or right before we entered, so that all of the amniotic fluid, the blood, etc., that initially comes out with the baby could be that we'd miss getting splashed with all of that, just to decrease our risk. All of the babies had already died, so we knew that we weren't there to do something to help save the baby's life at that point. Then another way we had to protect ourselves was to have another team on standby, that they could come in and start getting dressed and come in around 45 minutes after we had been in already. Again, it takes a while to get dressed, and then it takes a little bit of time to get to the site, so you need to have a system in place where you can be replaced right away, so you can make sure you're taking care of the mother well, but also taking care of yourself. Undressing procedure then is really important. It's one of the times where you can be at risk if you have bodily fluids, for example, on your external gown or apron. You get that splashed in your eye when you undress. That could be a time where you have risk for infection. So inside the birth room, we made sure to either pour chlorine, and we're using a 0.5 chlorine, so a very high level of chlorine for all the bodily fluids, for spraying down any of the pads or anything that held maternal blood or fetal blood. And we then sprayed ourselves before we left the room, just to decrease the amount of fluids that we might be tracking through. So then when we get to the undressing area, standard procedure, which is there's a sprayer there. The sprayer sprays us down on the outside, sprays our hands, both sides, sprays us front, then we turn around, sprays us back. Then we start taking off each layer. You take off your outer gloves first, and then after each thing you take off, you wash your hands again with a 0.5 chlorine solution. Then you take off the apron, you wash your hands again. Then you have to take off the goggles. When you take off the goggles, you close your eyes, you lean forward, you remove them. And then after you're taking off things that are reusable, you have to dip them in the chlorine water. Anyway, so after each time you take off, you wash your hands. And then the final stage is that you get your boots sprayed down, the soles of your boots sprayed down before you step out of the area. So one of the things that we now know is that pregnant women can survive Ebola, but part of the survival process means that they have to birth, and it's important that they birth in an Ebola treatment center because what we know very clearly now is that the baby, the placenta, the amniotic fluid all stay highly positive, have a high level of virus in them, even if the mother is cured or curing herself. So ultimately she can't be cured until the baby comes out. But if she births in a health center, if she births at home, if she births in a hospital, there's a risk of infecting any of the healthcare providers who care for her or her family or the midwives that attend her at home, because that baby is still positive.